Now, the Nigeria Center for Disease Control (NCDC) has reported alarming figures in the ongoing cholera outbreak, with 14,237 cases and 378 deaths recorded across 35 states and the Federal Capital Territory, resulting in a 2.7% case fatality rate. According to the NCDC Director General, Jide Idris, the outbreak disproportionately affects children under 5 and northern states like Borno, Adamawa and Kano being the hardest hit due to flooding. According to him, the agency has scaled up response efforts, deploying rapid response teams, providing essential supplies, and enhancing surveillance across the country.
Cholera, as we know, remains a serious public health issue, particularly in areas with inadequate water, sanitation, and hygiene systems, wash systems. And the NCDC, in collaboration with relevant stakeholders like the MDs, Ministry of Environment, Ministry of Agriculture, and other partners, have been working tirelessly to mitigate the spread of these and save lives. As of October 13, about 3 days ago, a total of 14,237 cases of cholera have been reported across 35 states and the Federal Capital Territory, and they span 339 local government areas. Sadly, 378 lives have been lost, resulting in a case fatality ratio of about 2.7%. The burden of this outbreak disproportionately affects the most vulnerable, these are children under the age of 5. This year has seen 2 significant waves of cholera, with the most recent surge reported during the week of September 29, Epi week 39, attributed to the heavy rains and subsequent flooding. This pattern we had anticipated, if you remember the last press briefing, having foreseen the risks through data and advisories provided by the Nigerian Meteorological Agency, NIMET. The floods in the northern states such as Borno, Adamawa, Jigawa, Yobe, and Kano have exacerbated the spread of cholera, making these states the current epicenters of this outbreak. Earlier in the year, the cholera cases were concentrated in southern states as the rains began there, but we have seen a shift, with the northern states now accounting for a significant proportion of the cases. The number of suspected cholera cases and deaths in 2004 has more than doubled when compared to this time last year. And that is where we are extremely worried. I know it was predicted earlier by NIMET that this year alone the rainfalls will be heavier than we've experienced. These numbers reflect the severity of the outbreak and reinforce the need for continuous vigilance and action. It also underscores the developmental issues that should be addressed both at the national and subnational levels, with the improved commitment towards addressing challenges relating to inadequate access to clean water, open defecation, poor environmental sanitation, food, and personal hygiene.